These to us are not microloans. These are our lifeblood. These are the ones that actually do the work day to day to day to day.
These seniors still need that level of friendship. They need that touch. They need someone to still be there.
So we bring everybody physically together with peer language groups so they can speak in their native tongue. We've had people in these groups skip family vacations to go to group. They're very serious about it. The bingo is a blood sport there.
We have a Chinese lady. She has kids over here, and her husband passed away around 30 years ago, and her kids, they don't speak Chinese fluently, so they can't have a deep conversation with their mom. So she's so happy to come to the senior center to speak and to talk with people similar to her, speak her language, express herself.
With our seniors, our goal, and I think part of their goals as well, is to maintain their independence. And so when you get to a certain point where you can't drive and you still need to eat and get to the grocery stores, you need to get to medical appointments. That helps them not feel so dependent.
We have one client who is visually impaired, but she's also an alcoholic and has been trying to stay clean. And she's also living at poverty level. We make sure she gets to her appointments to make sure she gets to her meetings. And, she couldn't do that if we weren't able to supply these rides for her.
We also don't restrict any of the reasons for our rides, because we know that getting to a medical appointment, whether you're coming here or to somewhere else, is important, but so is getting to the hair salon, getting to visit with friends, getting to go to a concert or something within your community, because that goes back to that individualized and comprehensive approach to helping our clients. We know that independence is defined by every single person differently.
There's another senior that he was also a veteran. We went in and built him a wheelchair ramp. So it was the beginning of the fall and he started a fire in the fireplace. Well, he forgot to open the flue. And so smoke filled his house and he was in a wheelchair. He couldn't get out. So thankfully a neighbor came and pulled him out, opened the flue, and there wasn't any damage to his house, but his PTSD spiked, his medicines doubled, tripled, and he couldn't sleep at night. He didn't feel safe in his house, and he was just having a really difficult time. We built him 2 wheelchair ramps, one to get out at the other side of his house too. And he called me up later and he said, "Chris, I can't tell you how much this means. I'm sleeping at night. My medicines have been cut in half. I can sleep. I can't tell you how much it means. I feel like I'm safe in my own home."